Kathy Hubert. Is Carrie able to unmute and speak to do the roll call? Okay, I'm going to get started. And Carrie, if you're able to do that, you can jump in at any time. I know, unfortunately, Carrie's having some connectivity problems this morning. So we'll start off with Allie Cronley. Anna Warhite.
My name is Anna.
Hi, Anna. Carl Bailey. Cindy Seeley, I know will be a little late. I don't know if her alternative is here.
Yes, this is Amanda. I'm here for Cindy.
Hi, Amanda. Welcome.
Thank you.
Neil Brady. Gail Weidman. Jay Harner.
Present.
Jennifer Ebersol. Juanita Gray.
Here.
Latoya Maddox. Laura Wilmer Rodak.
Good morning.
Good morning. Leslie Gilman. Linda Linton.
Linda here.
Lloyd Wirtz. Matt Seeley. Matt Seeley's here.
Yeah, present.
Okay, thank you. Mike Greer.
Morning, Kathy.
Good morning, Mike. Minta Livengood.
Good morning, Kathy.
Hi, Minta. Monica
Hi.
Vaccaro.
Good morning, I'm here.
Good morning. Pam Walls.
Hi, Kathy. I'm here.
Hi, Pam. Patricia Canella Duckett. Rebecca May Cole.
Good morning, I'm here.
Hi, Rebecca. Is there anyone, any of the members that didn't get a chance to acknowledge their presence during roll call?
Kathy, good morning. This is Jen Ebersol. I entered 2 minutes late.
Okay, well, you're forgiven.
Thanks.
Well, anyone else?
Hi, Kathy. Good morning. It's Allie Cronley.
Hi, Ellie. Anyone else we missed?
Yes, good morning. This is Patty Canana Duckett.
Hi, Patty. Thank you.
Thank you.
Anyone else? Okay, we're going to move on to the housekeeping points. This meeting is being recorded. Your participation in this meeting is your consent to being recorded. This meeting is being conducted in person and as a webinar. To comply with logistical agreements, we will end promptly at 1. To avoid background noise, please keep your devices muted and the microphones off unless you are speaking. Remote captioning is available at every meeting. The CART captioning link is on the agenda and in the chat. It is very important for only one person to speak at a time. Please state your name before commenting and speak slowly and clearly so the captionists may capture conversations and identify speakers. Please keep your questions and comments concise to allow time for everyone to be heard. Webinar attendees may submit questions and comments into the question box located in the GoToWebinar pop-up window on the right side of your computer screen, or use the raise hand feature to be put in queue to speak live. Those attending in person should use one of the microphones and wait to be called upon to speak. Before using a microphone, please press the button on the base to turn it on. You will see a red light indicating the microphone is on. When you are done speaking, press the button again to turn the red light and microphone off. If you have questions or comments that weren't heard during the 2 public comment periods, please send them to the resource account email found at the bottom of the meeting agenda and the LTSS Subcommittee webpage. Emergency evacuation procedures for those in the room. In the event of an emergency, go to the assembly area to the left of the Zion Church on the corner of 4th and Market. You require assistance to evacuate, you must go to the safe area located right outside the main doors of the Honor Suite. OLTL staff will be there and will stay with you until you are told you may go back into the Honor Suite or you are evacuated. Everyone must exit the building, take belongings with you, do not operate cell phones, do not try to use the elevators, they will be locked. Use stair 1 and stair 2 to exit the building. For stair 1, exit Honor Suite through the main doors on the left side up near the elevators. Turn right and go down the hallway by the water fountain. Stair 1 is on the left. For stair 2, exit Honor Suite through the side doors on the right side of the room or the back doors. If exiting from the side doors, turn left and stair 2 is directly in front of you. If exiting from the back doors, turn left and then again, and stair 2 is directly ahead. Stay to the inside of the stairwell and head outside. Turn left and walk down Dewberry Alley to Chestnut Street. Turn left to the corner of 4th Street. Turn left on Blackberry Street and cross 4th Street to the church. With that, I think we can move on to Juliet for OLTL updates. And if I could ask folks to be sure you're muted, that would help avoid background noise. And thank you, Juliet.
Thank you, Kathy. Just for the record, Lloyd is also present in the room. Hi, Lloyd. This is Juliet, Deputy Secretary for the Office of Long-Term Living. Just a couple updates today. We just have on our list again the procurement updates of what is currently still in blackout and what we can't discuss, and updates to any of those RFAs will be posted on the e-marketplace. Before we get into the budget presentation by Dan, I just wanted to spend a few minutes to share with you that the participant self-direction work group has concluded the majority of their work, which culminated into a final report with recommendations that are being and have been reviewed by myself and the secretary. And I want to thank all of the individuals who participated in that work group. They spent and dedicated a great deal of time looking at participant self-direction and its processes and recommendations to help the participant self-direction program continue to grow and really identify pain points and potential barriers that we can work on to resolve over this next coming years or so. There were many members from participants themselves who were common law employers and recipients of those services, in addition to direct care worker representation, the FMS vendors, our managed care organizations and service coordinators, including state staff, being led by Michael Hale and Jen Hale. So I'm really, really happy with the work that they've done. Would like to look at that as a model for other topics that we need to dive into in this upcoming year. The participant self-direction report will be posted publicly to the OLTL website. I do apologize, we've had some delays in posting. That is because the website is undergoing a sort of revamp, and that has caused some delays in being able to post new content. However, we also expect that it will go out via the listserv. If anyone hasn't signed up for the Community Health Choices listserv or any of our other OLTL listservs, we continually encourage you to do so. And with that, I'm going to hand it over to Dan Shar, our Bureau Director of Finance, who's going to go over the OLTL proposed budget for the fiscal 24-25 year.
Thanks, Juliet. Good morning, everyone. Nice to see everyone here this morning. So my name is Dan Scher. As Juliet said, I'm the Finance Director for OLTL. And I have just a few slides here this morning to talk about the 24-25 fiscal year budget request for OLTL. So a couple highlights. The budget request for 24-25 continues to reflect actuarially sound rate development for the CHC program, continued operation of the CHC program. Also includes continued expansion in the LIFE program, which is Pennsylvania's version of the PACE program. I'm sure many of you know. So the budget request also assumes or provides for continued expansion in the LIFE program, including an additional or funding for an additional 180 participants in the LIFE program. Also includes modest increases in both utilization and cost of care for all three of OLTL's main appropriations, which are the CHC appropriation, the LIFE appropriation, and long-term living. Long-term living appropriation covers or funds MA claims that are still billed through fee-for-service, as well as the OBRA and Act 150 waivers. So we do still have funding in the long-term living appropriation for those programs and the fee-for-service claims that still come through the Promise system. So the budget also, the last bullet here on the first, or the summary slide, we also include modest increases in the OBRA and Act 150 programs. So you would see that reflected in the numbers for the long-term living appropriation. So I show this pie chart every year when we do the budget presentation. And what you see on the pie chart here is actually where we our final enacted budget for the current fiscal year, which reflects in total about $15.3 billion in state and federal funding for OLTL's three main appropriations. Community Health Choices, of course, is the largest piece of that pie, about $14.5 billion of the total $15.3 billion. And as I like to remind everyone during this presentation for the proposed budget, at this point, of course, it is still just the proposed budget. The final enacted budget will be passed and signed by the governor in June, or well, by July 1st, as is required, or at least that's the hope every year. Our total, and just for reference, the $15.3 billion that makes up the current year, the 23-24 appropriation, if you compare that to what's in the proposed budget, it's about $15.5 billion. So roughly a 1.5% increase in the requested budget, a little over $200 million across the three appropriations. So I'll start with of course, the largest, which is our Community Health Choices appropriation. It includes MA long-term services and supports, our capitation payments to the CHC MCOs, as well as OLTL's operating grants and contracts. In the current year, we, as I said, have a total state, federal, and other funding. Other funding includes funds that we receive that are transferred from the lottery and tobacco settlement funds. For the current year, we have, as I said, 14.5 or just over 14.5 billion in the CHC appropriation, and our requested appropriation for the 24-25 budget is about 14.87, which is an increase of about 290 million in state and federal funds. The long-term living appropriation, as I mentioned, includes MA fee-for-service claims, as well as the OBRA and Act 150 programs. The current year's funding is about 325 million. The 24-25 budget request is approximately 252.5 million. And I will point out that I realize looks like a decrease, but is perhaps a little misleading because the current 23-24 number includes payments that are appropriated through the fiscal code each year. So things like the non-public MA Day 1 incentive for nursing facilities, as well as in the current fiscal year, there was a supplemental payment, an additional supplemental payment. And because those are not essentially guaranteed payments each fiscal year, when we do the budget request, we take those out of the figures that go into the budget request. So largely what you see in that $72 million decrease just reflects the removal of the fiscal code payments that are part of the 23-24 appropriation figures. And last but certainly not least, the long-term care managed care appropriation, which is the LIFE program. The current year funding or appropriation is 391 million, 391.5 million to be more precise. And the 24-25 budget request is 395.1 million in state and federal funding. So that's essentially the budget request for 24-25. It is largely a cost to carry budget request. As I said, there's the fiscal code payments removed from the long-term living appropriation. We assumed our sort of normal modest increases for utilization and cost in CHC, long-term living, and the LIFE appropriation. So that's, I think, sums up our budget request for 24-25. I'm happy to answer any questions that folks may have in the room or online.
Thank you, Dan. This is Kathy, and thanks, Juliet. Before we open the floor to questions, I want to mention that fortunately, Carrie Bach, our co-chair, has been able to join. And I also want to acknowledge member Gail Weidman is also present. With that, we can open up questions to Dan and Juliet. Is there any in the room?
Lloyd has a question.
Good morning, and thank you for your presentation. Appreciate it. I think I asked this question once before, and I'm not sure that I got the answer. Is there an estimate on how much the Commonwealth is able to save for an individual who signs up for the LIFE program as opposed to going into traditional MA as an enrollee into the CHC program?
Thanks, Lloyd. I appreciate that question. And yes, I apologize if I didn't get an answer to you in response to the previous question, but as I'm sure you're aware, the LIFE program is dual funded by both Medicaid and Medicare. So it is difficult to do an apples to apples comparison between the LIFE program and CHC participants. Of course, we every year as part of our capitation rate setting process for both CHC and the LIFE program. We look at expenditures, expenditure history, and particularly when we're doing LIFE rate setting, it is a slightly different process than what's required for CHC, because CHC requires actuarially sound capitation rates, whereas the LIFE program requires rates as a percentage of the amount that would have otherwise been paid for the LIFE participants. So the rate setting methodologies are slightly different, but we do work with the actuaries in both programs to develop appropriate capitation rates for both programs.
All this to say, Lloyd, is that we'll go back and take a look at the numbers, and it may not be a precise estimate, but we'll try to get you the answer you're looking for.
Any estimate would be appreciated, and I think.
Thank you. Leslie Gilman has a question. Leslie, would you want to unmute yourself?
Yes, thank you. Can you hear me?
Yes.
Yeah, I was just wondering, thank you for that presentation. It was very helpful. I was just wondering about the budget for adult day centers, since centers providing adult day services have not had an increase since 2010, and costs have gone up considerably in the past 14 years. So has any of this money been earmarked specifically for use for adult day services?
Thank you for the question, Leslie, and I agree absolutely that rates have not gone up for the adult day centers for quite some time. As you may be aware, we are embarking on the HCBS rate study this year that will help inform the next budget. And that work is going to get started underway very, very soon. We'll be looking in depth at adult day services as one of the HCBS services under evaluation to look at that data and provide that critical information to the governor and our General Assembly to help inform future appropriations. As you know, under Community Health Choices, it is a capitation payment to the managed care organizations. So given that it is a capitation payment, there aren't earmarks necessarily generally for specific provider rates, given that the CHC MCOs negotiate their own contracts with their provider networks. I can say in the fee-for-service program under OBRA, there is not an earmark for any rate increases in the fee-for-service schedule at this time.
Hi, this is Monica from the Brain Injury Association of Pennsylvania. I just wanted to point out that a similar situation exists in the brain injury community with rates not being increased. Residential providers are struggling, and brain injury seems to be left out sometimes when there's new funding identified, and I'm just asking that group be considered when you're doing this review as well.
Thank you, Monica. I can confirm we will be looking at brain injury providers, particularly residential rehabilitation, as part of the HCBS study.
Great, thank you.
Juliet, what is the time frame that that analysis is going to be done, or what are you anticipating it to be?
Leslie? I'm not sure.
Yes, it's Leslie.
This is Juliet. So for us, as folks recall back to the 2012 rate setting process, or the rate review process, I should say, I was part of that provider team that embarked in that in partnership with the state and Mercer. That time took, I think, over a year. That is not our intention. We really want to have a very fast-paced timeline so that we can get the information and the data to a point where it can be confidently shared prior to next year's budget process. So it is our intention to try and wrap up the work by the end of this summer. As such, what we need to sort of level set here is in the last rate development process, there was significant stakeholder engagement all the way through, meeting after meeting. A lot of us dedicated a lot of time in that process. Unfortunately, for us to be able to meet what I think is most critical, which is getting the data and the information as correctly as possible and in the hands of those that are making our decisions for the future years, while we will have stakeholder engagement, and our intention is to have that stakeholder engagement very much so on the front end, and then periodically throughout, we do have to make some concessions that we're not going to be able to have that vigorous stakeholder engagement in order to meet the timeline that we have. We did share this with, provider associations, and I feel like there was agreement that the timeline was most critical because of the pressures that providers and other members are under. I hope that helps.
Yes, this is Leslie. Very, very much so. I really appreciate hearing that. And it is critical. The time frame is really important to the survival of adult day services, quite honestly. And we appreciate working quickly on that. And we certainly also offer to assist in any way possible if there's any information that's needed. I happen to have been involved in the development of the increase all the way back in 2010. So I know what went into that. So if there's anything PADSA could do, we'd certainly be more than welcome.
Thank you. We're going to count on that support.
Are there any other questions in the room? Any other member questions before we move to see if there's anything in the chat?
I don't know that, Lloyd works again. I don't know that it even applies, but is there any anticipation for either improved services or decreased costs to the OLTL with the hopeful implementation of the Keystone Steps to Wellness waiver submission that's, I believe, in the hands of CMS as we speak?
Thank you, Lloyd. I believe you're referring to the 1115 waiver demonstration. Yeah, so that is with CMS right now. They, I think, went through their public comment process. We'll receive that information back. There's certainly a lot of excitement in the potential for the 1115 program to really help us get upstream across DHS. With regards to the impact for OLTL, it's certainly going to be very welcoming to be able to have sort of additional services in addition to our robust array of services that we have today. I think that the impact is going to be felt very broadly across DHS, so I couldn't say specifically what the impact or anticipated impact to OLTL might be at this time, but we're certainly very excited.
Thank you. Are there any written questions in the chat for Juliet or Dan?
Hi, this is Paula. No, I have no questions in the chat.
Thank you, Paula. And before we move on to public comments, just the last, be sure there's no one else in the room that had a question or comment. Okay, thank you. So now we can move on to the open forum of public comments, and we can start with anyone in the room.
So we do have someone in the room.
Go ahead, the floor is yours. Thank you.
Hi, this is Rick from Voices for Independence. I have a question still related back to the HADMA benefit. We're still seeing a problem and I think I have the fix for the problem, but the piece is under HADME, it's the ramp, stair glides, vertical platform lifts, ceiling lifts. That requires somebody to go home, do an evaluation to determine if something is even going to work. With MA currently, I believe there's only 3 providers, which we are one of. That it's not like a shower chair or a normal DME where you can just order that. We have to go there. We have to evaluate. We have to determine what the best way is going to be. Currently, there's no place, there's no modifier that a provider can, go ahead and even put that in there, because the fee to go out and do that design, we'll call it design work, to put that in there. And I've submitted projects under MA, and they've gotten that. The job gets approved, but it goes to rate negotiation, and they kick it out. So, versus creating another modifier, my thought would be to just change some verbiage to the E1399U2 that would allow for a design that we're able to, incorporate that in there. Because again, this is not ordering a shower chair from online. We have to physically go to each job in 67 counties to get that information to be able to submit. And currently there's nothing there that allows a provider to get any reimbursement for that part of it.
Appreciate the comment and feedback. Taking notes. Patty?
Regarding Patty Sahar from RCPN, regarding the rate study that you're conducting, focused on the overall waiver and Act 150 services, will those become the floor rates that will be baked into the capitation in years moving forward? Or how will that study be reflected on the vast majority of the services being delivered?
That's a great question. So there isn't any intention at this point to add additional floor rates for CHC. With regards to how the capitation process works, it's not a direct tie apples to apples. However, all the information and changes that would be in sort of like the marketplace of services is considered when the actuaries put the rates together. So if they are looking at the Medicaid fee schedule, which oftentimes they do as sort of a benchmarking tool, then any changes to that fee schedule would be part of that consideration for that benchmarking. So it would sort of be incorporated into the actuarial process for capitation rates.
Is there any way to advocate for more floor rates?
So that's a good question. I would advocate no for that personally, but we can certainly take that back and discuss and look at it further. And the reason for that is because under the capitation rates, what we want to provide is that flexibility for the managed care organizations to successfully contract and manage the program with their provider networks. If OLTL were to put floors for every single service, kind of goes back to that sort of fee for service, and that's not the intention for CHC. The managed care organizations have the responsibility to manage the program to meet people's needs and have the network adequacy with the resources provided to them.
One last question. Will it be publicly communicated how the increases in the capitation take place with the MCO? Because those capitation rates are seen sometimes 6 to 9 months after the rates actually take effect. So as providers, we don't have the opportunity to negotiate with facts when we're approaching the MCO. So is there a way that you can help us get that information sooner?
Yeah, that's an interesting point that you bring up. I'll take that back and review it with our team. Dan's here, so he heard it, so he knows it's going to be on my list with him, unless he left. Now there he is, hiding.
Hi, this is Kathy. I'm sorry to interrupt. I'm getting some feedback that it's hard to hear some people in the room and is the microphone being used? And I'm also want to remind folks online to mute yourself so we can avoid the background noise and typing. Thank you.
Kathy, I don't see any additional questions in the room.
Thank you, Juliet. Is there anything in the chat, or does anyone have their hands raised?
Hi, this is Shanrika Pine. This question comes from chat. It's from Kelly Barrett. Has there been any progress on the scheduling of the next MCO Transportation Summit?
Thank you for that question. So at the last MCO Summit, it was indicated that Zoom is the preferred technology platform for holding the next Transportation Summit. So the delay to scheduling the Transportation Summit is our team's effort to get Zoom approved as a technology platform for us to use. One would think it's simple. When I was in the private sector, I could just swipe a credit card and use Zoom. We have very rigorous processes here at the Commonwealth with evaluating particularly technology for very good reasons. As we know recently, that vigorous review is important. And so it is still working through that process of approval. As soon as we can get that platform approved, Randy and his team will be looking to schedule that additional Transportation Summit as soon as possible. However, they are in the final stages of also responding to and putting out a frequently asked questions that came out as a result of the first summit. So we'll be looking to push that out over the listserv and hopefully posting to the website in the very, very near future. So that's the update I can provide.
Thank you, Juliet. We also have a hand raised. Brenda Dare, you are going to be unmuted.
Thank you. This question is for Juliet about the rate study. And I said this in February, and I'm going to say it long and loud. Folks are really, really struggling. We need some sort of guarantee that as rates are studied and new rates are implemented, there is some direct correlation to the actual pay rate given to direct care workers. I understand the providers are struggling to meet their cost as well, but we've got to get, if we want to avoid a catastrophic level crisis, we've got to get more money into the hands of direct care workers for retention. And the first thing we need with that is sick pay. It costs the Commonwealth much more money to deal with an illness for somebody who goes into the hospital because their direct care worker came to work sick, but we don't have the flexibility to give them sick days. So I'm here to ask again, as rates are studied and new rates are implemented, please, please give us the assurance that we'll be given some flexibility to be able to implement things that save us money and save our health.
I couldn't agree with you. Absolutely. The direct
Thank you.
and the wages for direct care workers absolutely need to be considered, and ensuring that they are paid livable wages is our goal. You may have heard the Secretary talk a lot about that in budget hearings, in her confirmation hearings about the importance of the direct care workforce. And I just have to take this moment to say, while we can do the rate study, it's going to be incumbent on everyone to ensure that our representatives are educated about that study, about the value of HCBS services, and the critical value of direct care workers. So while we'll have this study and try and get it out to everyone as far as wide as we can to provide that data and information, there's going to be additional work and partnership that's going to be needed from everyone in our systems to kind of carry that across the line. So thank you.
Good morning, this is Carrie. Can you hear me?
Yes.
All right, we're back in business. Thank you. So I have a question that has come to me in between meetings, and with the focus on employment and of course the continued shortage of direct care workers that we just spoke about, the question is, why is it that participants in the CHC program are not able to work as a direct care worker for another individual, even though they themselves may qualify for the program and have their own needs, but they are able to meet the needs of another individual enrolled in the program? Why are they not permitted to be direct care workers in those cases?
So Carrie, that's an excellent question. I'm going to have to get back to you on that because I haven't looked at that question. So I'll need to go back with my policy folks and kind of clarify what is and isn't allowable with regards to that type of employment. So I'm not even going to hazard a guess at this point, but we'll certainly get clarity as a follow-up.
Okay, thanks, Juliet. Do we have any other questions? This is Carrie again.
I don't see any in the room.
Okay, and I do see that Cindy Seeley has joined us. So just to make that announcement, she's here with us.
Hello, can y'all hear me?
Yes, who is this?
This is Latoya Maddox. I'm on as well. I was sent the wrong link by accident, so I got the right link.
Yep. Hi, Latoya. What question do you have today?
I don't have a question. I just let y'all know as I'm a subcommittee member. I'm letting you know I'm on the meeting.
Thank you. Thank you so much for announcing that you've made it.
You're welcome.
And we make sure the record reflects that Latoya has joined us.
Hi, this is Shanrika Pine. There is a question in chat from Karen Starr. How has OLTL communicated to LTSS that CIL will be providing nursing home transition sessions and facilities? I ask as we are seeing incredible resistance from LTSS to schedule outreach. We have provided the families with the letter from OLTL and the Department of Secretary, and this makes no impact. Thank you for helping me understand how this will be shared with facilities.
Hi, Karen. Thank you for bringing up that topic today. It's absolutely a very important one. In terms of sharing that information, again, we have issued a letter from the Office of Long-Term Living to Pickle, who is the vendor to provide these training sessions and services within nursing facilities. Michael Greer has presented at a prior MLTSS meeting on this, and I do believe information also went out on the listserv. Looking at Jermaine, yeah, it went out on the listserv. I believe it was also announced and shared at our nursing facility quality training sessions that are held and sponsored by our bureau team. We just met with Pickle with regards to extending their contract this week, and also discussed different strategies that Pickle also can embark on to further build partnerships through the Ombudsman Office, reaching out to the nursing facility trade associations, and hopefully partnering with them as well to increase awareness, access, and encourage nursing facilities to hold and have Pickle come in and do these training sessions. I know two nursing facility trade associations are committee members, and I'm sure that they will take this back and hopefully reach out to Michael Greer, another committee member, and have further discussions on how to improve that process. I'll hand it over to Mike Greer to see if he has anything else he'd like to share.
Yeah, I just wanted to let you know, Karen, we covered this yesterday in the pickle board meeting. I just haven't had an opportunity to get everything out to folks yet.
But this is a great reason why the MLTSS and LTSS committees are merged and all one happy family, so they can connect and discuss. Thank you.
This is Kathy. Is there anything else in the chat or any hand raised?
Hi, this response is for Juliet from Karen Starr. We have provided the facilities with the letter, not the families, and I'm still getting many doors slammed in my face.
Thank you for bringing up that feedback, Karen. I am hopeful that will change in the near future with additional efforts and outreach and partnerships across the board, as I previously mentioned. But thank you for bringing that up. It's really important that we all work together to ensure that participants and residents truly have informed choice, understand the processes, and we are all working together to ensure that people who want to be served in their communities and homes are able to do so.
Hi, this is Pam Walls. Could I just ask a question about that? I'm wondering whether the CHC MCOs could play a role in getting their contracted long-term care facilities to, open their doors to these sessions.
I'm sure they could. Sure Pickle has a list of folks after our call to really outreach and engage with. I don't see any additional questions in the room. Shanrika, any in the chat?
We do not have any additional questions at the moment.
This is Carrie, and I just want to remind everybody that as you enter questions in the chat, if by chance they don't get answered today, everything will be posted now instead of reading the questions during the meeting. We did decide to post them all online to save time during the meeting to allow for more interaction and time for people to ask questions and make comments. So just wanted to remind everybody of that. So if we have no more questions, then I think we can move on to our next agenda item, OLTL participant resources, if Randy's available.
I'm sorry, this is Jay Harner. I have one question.
Oh, sorry, Jay, go for it.
So we were talking about the funding issue with direct care workers. That's, we've been talking ourselves blue in the face. And then Juliet chimed in saying that, we can do these reports and these studies, but basically at the end of the day, it's going to come down to legislation and passing the funding in a budget. Has there been any work or any looking into getting statements or comments from the leaders in the House and the Senate on where they stand with expanding funding? Because I think that should be something that all of us on this committee should be aware of, especially with it being election season, because I know we all have our things that we vote on and why, and we choose who to vote for. But I would be interested to know if there's any public comments made from the leaderships, specifically the leaders of the committees, where they stand on increasing funding for direct care workers.
So I can say for the Office of Long-Term Living, the typically not something that we go out and collect, sort of in our role of operations, but, you know, certainly can defer to Kathy and Carrie.
Yeah, this is Kathy. I think it's a good suggestion, but it's something I think organizations and individuals, need to, respond to. And I think in many ways, many of us are already in the process of advocating on these issues. I'm not sure in terms of this body, unless someone wants to help organize and collect the information and discuss a process. We could certainly be open to that.
Lloyd?
Hi, Lloyd works here. It would seem to me that this is an issue that might be best addressed by encouraging some member of the legislature, either the House or the Senate, to hold a hearing on the topic, and sometimes you can get more input in the hearing that is then placed in record, and there's an opportunity to review that. My question, though, goes back a little bit, and to the decision that seems to have been reached about sharing responses to questions that were not answered during our meeting in different ways than we had. We had been offering that, and I thought it was a great idea during Mike's reign on the LTSS to be able to hear responses to questions that were posed at the previous meeting. That's not going to happen anymore, or how did that get decided? I don't recall having a vote on that or any input into that.
I defer to Kathy and Carrie.
This is Kathy. Thanks for that input, Lloyd. We have, as you know, we've been trying to get input from members about improving the meeting, and we have the most response we got was that we need more time in the meeting to hear from participants and the open forum section. It seemed like people could read those responses. I was hoping to actually see them in the handout section and post it with meeting materials. I'm sure they'll be sent out, that people could read that information and, we can follow up accordingly. If that's not what the group wants to do, we can certainly add that back into the agenda. But it seemed like people could read that information and see the follow up and allow more time for participant participation, but we're open to feedback.
Thank you.
This is Carrie. Yep, I also want, sorry, Lloyd. This is Carrie. I also wanted to add that we recognize that not all questions from the previous chat were being answered in the following meeting, which is why we decided that maybe it's just a better technique to put all the questions posted. But yes, as Kathy said, if we want to go back and take the time and make sure that all questions are answered and are not just pick and choose which ones will be answered during the next meeting, then we are definitely open to that. Thank you. Go ahead, Lloyd.
No, that's fine. I'm just the kind of guy, when I get an answer, then another question pops up, and that can never happen, if it's a written response. It can only happen during the lively repartee during a meeting, which I find to be very effective. But thank you.
Hi, this is Shanrika Pine. This question is, it's actually a comment. This comment is in chat from Mia Haney. PHA has advocacy day next week. Happy to discuss collaboration and attendance with any interested parties. She also provided her email, which is mhaney@pahomecare.org. The next comment comes from Catherine Badonsky. I agree. Hearing the responses is helpful, and I would advocate that co-chairs talk to MLTSS on how they made it work.
Thank you. I also wanted to add, Lloyd, to your comment for folks' awareness that on April 8th, Monday, the solar eclipse day, there is a committee hearing on home care led by Representative Kinsey and others. So April 8th at 10 o'clock, there will be a committee hearing.
Okay, I think we can move on now to Randy, and then we'll pick up additional public comments at 11:50. Thank you.
Thanks, Kathy. This is Randy Nolan from the Office of Long-Term Living. Hope everybody's doing well on this nice rainy start to the month. I'm going to talk a little bit about participant resources. So we had some questions that came in, so I'll read the questions and then provide some answers. Question was, what area of OLTL oversees the helpline? Within the Department of Human Services, the Office of Long-Term Living, the Bureau of Coordinated Integrated Services, one of my divisions of participant supports oversees the participant hotline for the Office of Long-Term Living. What are the days of operations? They're open. The line's open Monday through Friday, 9 to 12, and then 1 to 4. Voicemail is available, and we follow up on all the voicemails that come in. How do we contact the helpline? The number is 1-800-757-5042. This unit also responds to correspondence that comes in from the governor's office, the secretary's office, through legislative affairs. They handle all the correspondence comes in regarding to participant-related issues. Who can contact the helpline? Anyone can, including providers or others calling on behalf of a participant, the participant themselves, the service coordinator or the agency that's working with them, friends, family, anybody can contact the hotline when there's an issue or a question. Just know that OOTL will not give out any information about a participant unless the participant is on the line and allows someone to speak for them. Under what circumstances should we contact the helpline? The helpline will assist as best as they can with any type of inquiry. Participants who contact their provider or service coordinator should contact their provider or service coordinator first. And we work back and forth when the participant calls. We will work with the managed care organization to help resolve the issue. The way my participant support team is set up, I have team members that are responsible for each of the MCOs. They work directly with the MCOs when a call comes in. Question was, what should a caller expect when they call the helpline? We're going to ask some identifying information about the individual, name, last 4 digits, Social Security number, date of birth, and current address, so that we can look them up in the system, so that we can verify the individual through our ESIS system. So that's part of the information we ask, and then the follow-up is to listen to the issue, complaint, or concern that the participant has, and which is all documented. After the call, what happens is, like I said, it's the MCO's responsibility to follow up with these participant-related issues. So once the call is completed, we determine whether it's an urgent or non-urgent situation for the individual. Urgent issues may include health and safety related issues, abuse, neglect, exploitation, or some other type of service interruption. So we consider those as urgent, and we handle those right away. Urgent issues are sent over to the MCOs immediately, with a response expected by close of business the same day for calls received before 3. So if somebody calls at 1 o'clock, we send it to the MCO right away, and we expect a response back from the MCO by the close of business. If they call at 4 o'clock, then we expect the MCOs to follow up with us by 9 the next morning. For non-urgent calls, we have the MCOs respond to those within 3 days, 3 business days. Like I said earlier, every call is assigned to a team member that works directly with the MCO. So they have the relationships built with the MCOs. And again, the MCO is the one that will follow up with the participant. So if you call and you have an issue with your services or some other situation, we'll refer it back out to the MCO. It's your responsibility, the MCO and their service coordinators, to reach back out to the individual participant. Other things that would be important for or helpful for the public to know. One is participants have multiple ways that they can reach out if they have a question, concern, or issue that needs addressed. Obviously, their first avenue is through the service coordinators. Each of the MCOs have a participant hotline that they can reach out to. If they don't get satisfaction with that, we have a participant hotline they can reach out to that we've talked about. Obviously, individuals go and talk to their legislators, their representatives, and the information comes in through that way. So there's multiple ways, and the helpline, OLT helpline, is just one of them. They can call the independent enrollment broker if they have an issue or question about services, and that's part of what we're moving forward with the new contract with Maximus, is to provide some beneficiary support services so that the IEB can assist participants if they have an issue with their MCO. If a participant's in a nursing facility and they have a complaint, they can call the Department of Health's complaint line. The number is there is 1-800-254-5164, and then the Department of Health will follow up on the complaint. They can also reach out to their local area agency on aging, and we work closely back and forth when a complaint comes through about the CHC program with the Department of Aging. So, as I said, there's multiple ways that we can help participants out, and they can reach out to us. Just some data so you can see. The first slide is the number of calls that came in 2023. You know, we had 6,567 calls for the year. So there's a breakout by month. So we're averaging about 500 calls a year that come in on that line. And the next slide shows you the 24 data. Obviously, we're, again, right January, February, right there, over 500 mark for this year so far. Some of the other data I'd like to present to you is the list of call sources where we get calls from. We get calls from our sister bureaus, like the Bureau of Program Integrity. We get calls and items that come through the Secretary's office or through the Governor's office or executive staff. Direct calls from the participants obviously is our main call source. 4,200 plus are direct calls. We've gotten calls from the IEB. We get legislative inquiries that come through the representatives and then through the legislative office over to us that we follow up on. The Medicaid Research Centers, the University of Pittsburgh, they do surveys with individuals, and when they talk to them and the participant says that they have a problem or concern or issue, they refer that to us and we follow up on it. And there's about 1,700 calls that come into voicemail. We're attempting to try to answer as many calls as possible live. This number has greatly reduced over years. It used to be that we were hitting probably about 60% of our calls went to voicemail. We've added some staff to this unit that has changed that dynamic, so we are having the ability to talk to people live more than we have. So we'll continue to improve that piece of the puzzle. So the next couple slides talk a little bit about the reasons for the calls. As you can see, the first one there is appeal, complaint, and grievance related questions. We had 500 calls on that. Our biggest call driver is enrollment eligibility related issues. We had over 1,500 calls for that. Calls on benefits coverage questions. Calls on choice, being able to make a choice for a new MCO. We had a number of calls, over 200 calls in regards to questions with the end of the public health emergency, especially on the financial eligibility related side. We get calls from estate recovery questions, fraud and financial abuse, health and safety abuse, neglect, exploitation, or abandonment related issues. We get calls on that. Numbers you'll see here, like with the asterisks, that means we've got less than 10 calls for those individuals, so we don't list those numbers. It's kind of the data review that we do. So anything that has an asterisk is because we have a small number in that area. Over 560 calls in regards to past services. We have a catch-all category, which is a general category of people calling in, and we have over 650 calls that fit in that category. Over 550 calls related to program services in general. And then, you know, we've had a number of calls about home adaptations and DMEs. And then we've even had calls about provider inquiries where people are trying to, you know, find different providers. As you can see, we had over 460 calls that we're not sure what the call was. We even though we're the state, we still can't get protected from spam calls, just like everyone. We get the spam calls, so we get a number of them that come in on this hotline. Some calls about renewal questions in regards to the NFCE, NFI questions, and then, you know, the other big call center down there is voicemails. We've had over 500. We would attempt to call back and we leave messages. So we continue to try to call participants back when they have questions. The next set of data is the number of days it takes for us to issue and address the issue with the MCOs and close the issue out, meaning the MCOs respond, they reach out to the participant, they resolve the issues. We have close over 4,940 of those that we are resolving in the first 1 through 5 days. And then you'll see as it breaks out, as it goes through, you know, 6 to 10 days, 11 to 15 days. We do have some cases. I mean, when you get into the higher numbers where the asterisks are at, these are hard to place cases, hard to resolve issue cases. So that's why some of the cases we have that are, you know, over 60 days, you know, some of them on the next page, you know, we have a few sprinkled in these categories, like I said, less than 10 that really stretch out, and they're really hard and difficult cases that we're working with the MCOs on resolving. And that's the data. It's a picture of me, but it's an old picture before my beard on the questions slide. So just, you know, before I take some questions, just as a wrap up, this unit, this is one of the divisions that I have, Division of Participant Supports. This unit is one of the sections within that division called Participant Supports. They handle everything with the participant hotline. This is also the unit that handles the hard to place cases and difficult issue cases within that unit. So they provide a lot of work. They're on the phone. 5, 6 staff every day are on the phone answering these calls and doing follow-up and doing repeat follow-up calls to people. So this unit does a lot of work and has a lot of input in how we, you know, drive the system to try to resolve participant-related issues. So, any questions? I enjoyed this topic more than I did the last one.
Andy, I do have a question in chat for you. This is Shanrika Pine. This question comes from Janice Minard. Randy, how does OLTL respond to participant calls when their issue is with their CHC plan and participant looking for OLTL to take action with the plan and want a response from OLTL?
If the issue, it's really hard to answer that without having a specific situation, but if the issue is with the plan that the plan is not providing them services, we're still reaching out to the plan to resolve the issues. If they want to file a formal complaint against the plan, then we would address that. That would come to me and I would review it. But if it's an issue that they don't feel that they're getting enough services, or they didn't like the results of their last assessment and resulting reduction in services. I mean, that's still issues that they have to work out with the MCO. They have the appeal process with the MCO. They have the fair hearing process with BHA. So a lot of the issues still have to go back, and we have to address them with the MCOs, because it's the MCO's responsibility to make sure the person's getting the services that they need and they're getting the responses that they need. If it's an issue that they've said they've called the SC 5 times and they refuse to call them back, then we're dealing with the MCOs on that and making sure that they correct that problem. And that problem either is assigning a new SC or figuring out what the issue is between the SC and the participant. So it kind of varies and would depend upon the issue itself.
Thanks, Randy. We also have a hand raised. Brenda Dare, you are being unmuted.
Thank you. Randy, I just need a little bit of clarification. Again, this is Brenda Dare from PA Silk. Very good presentation, very thorough, but I just have one question, and that is, are Act 150 and OBRA participants not able to use the hotline to resolve issues that they may have? All of your presentation details related back to CHC, and I just wanted to clarify that.
Any participant that is involved in an OTL program can call the participant hotline. We do have participants from the OBRA program and Act 150 program call. We refer those over to the Bureau of Fee for Services, who over in OLTL, who oversees Act 150 and OBRA, and they follow up on the calls. So we just track that we followed up with OBRA and Act 150. Individuals in the LIFE program are also can use this phone number to call in if they have issues with the LIFE program. And then we work with one of my other divisions that oversees the LIFE program to resolve the issues.
Thank you. I just wanted that clarified for the record.
Sure.
And not to be forgotten, CHSL participants can also call our hotline for support as well. So any OLTL participants in a licensed personal care home or assisted living residence, they also can contact the helpline or any of our field offices as well.
Yeah, to that point, we've actually had people call into this participant hotline that are not in the CHC program or any other program, and we assist them. They might be looking to enroll in the program, so we assist them and refer them over to the IB if we have to. So it's available for anybody's use.
Well, thank you, Randy, for your presentation. This is Kathy. That was very helpful information. We need to move on now to the MCO's presentation, and unfortunately, we're a little behind schedule, so I'll ask you to be as concise as possible. So we will stop at 11:50 for additional public comments. But I'm not sure if Amera Health, it looks like, is going first, and the floor is yours. Thank you.
They're coming to the table.
Thank you. It was a long walk, so thanks for giving me the time to get up here. My name is Nicole Ragab. I'm with Amera Health Caritas and Keystone First CHC program.
Can you pull the microphone?
Oh, yes. Can you hear me okay? Better? Great, thank you. With Amera Health and Keystone CHC programs, going to talk today about our participant advisory committee meetings. On the call today with us is also one of our participant representatives and who is in the Northeast Participant Advisory Committee. Jay Harner is on the call, available to be part of the conversation as well. So our Participant Advisory Committee meetings are forums for PAC members to advise the plan on experiences and the needs of our participants. PAC meetings provide an opportunity for our PAC members to consult with each other and coordinate efforts and resources for the benefit of the full CHC population. And as a plan, we're responsible for presenting PAC agendas that include useful information to our PAC members, such as updates, proposed changes, quality improvement strategies, and implementation. And during the meetings, our PAC members have the opportunity to raise questions and concerns about topics affecting their quality of life and their experience with the plan. PAC attendance and PAC membership includes participants, family members, direct care workers. We have provider representation on our PACs, as well as engagement from our Centers for Independent Living and our community-based organizations. All participants who are interested in becoming involved in the PAC are invited to attend and join for the PAC for the zone in which they reside. Family caregivers can join with participants as their authorized representatives, and direct care workers offer really valuable insight and offer a unique voice to the meetings as well. Provider representation includes physical health, behavioral health, dental, and LTSS. And a unique part of our PAC meetings outside of the required membership is really our participation from our SILs and our CBOs. They attend and offer feedback at our meetings. They offer opportunities for our participants who are looking to be involved in their communities through events, through other initiatives that are happening in the zones where they are. And they provide meeting spaces for our PAC meetings as well. So participants that are interested in getting involved can do that in quite a few ways. They obviously can call our participant services line for each plan. They'll be routed to our community outreach team, engaged in the PAC. They can email our community outreach team directly. We have a dedicated inbox for each of our plans for our PAC meetings, and they can email that contact to get enrolled in the meetings. They can join a meeting through the Zoom link that we provide on both of our plan websites. They can connect with us in the community. They can connect with their service coordinator. We try to make sure that there are as few barriers as possible to joining a PAC meeting. So anything that we can do. And then we educate about our PACs in a few different ways as well. Through our participant welcome kit, both of our plan websites, we have a dedicated space for our PAC meetings that includes dates, times, like I said, the Zoom link to the meetings, as well as a history of all of our meeting minutes. We educate about our PACs through our participant newsletters, and then also through service coordination, engagement, and outreach. We're meeting regularly. Our community outreach team is meeting regularly with our service coordination teams, educating them on the PACs and getting participant recommendations. Those participants that are interested in becoming involved will get recommendations that way. We hold our meetings quarterly. March, June, September, and December, but then we also hold ad hoc PAC meetings throughout the year. If there are topics that would be benefit to have a single issue PAC meeting, we can do that throughout the year as well. Our meetings are held in person in our zones at either our wellness centers or in other accessible community spaces, but we continue to offer a virtual login option through Zoom to accommodate those who cannot travel, who might have other events or appointments on that day, and it would be easier to join virtually. You can expect during our PAC meetings introductions, updates from providers, from participants, from our community partners, health education updates from our community outreach team, important information and reminders from the plan. In 2024, we're spotlighting all 32 home and community-based services. So we have a portion of our meeting dedicated to defining those services, talking about access to those services. And then, of course, a really important part of our meeting is our open forum for questions, concerns, and feedback, opportunities to bring questions to the plan outside of the agenda items. So from that, you might ask how are questions resolved? How is feedback addressed from PAC? All plan and participant related questions that come through the PAC are escalated internally and addressed with participants or their authorized representative outside of the meeting to protect PHI. Resolutions are communicated back to Office of Long-Term Living through our Regulatory Affairs Department. And oftentimes, if a question is specifically related to CHC contract language, OLTL will offer clarification and be involved in the communication with that PAC member as well. And then all questions, feedback, and resolutions are documented in our meeting minutes and posted to our plan website. In terms of providing accountability and transparency from the PAC, many of our participant and health education materials are reviewed by our PAC members to offer feedback before they be implemented, whether that's in the design of the resource, whether that's in the rollout of the resource. We use our PACs as a way to get that feedback before implementing an initiative. And then, of course, our PAC policy and our PAC meeting minutes are reported through our quality committees, the Quality Service Committee and the QAPIC Committee as well. And that policy is there available for access as well. And then before I open it up for Jay, we had one other participant testimonial that I'll offer today. This is a participant who resides in the Southeast. She said that the PAC meetings have really helped her become a part of her community. She's enjoyed learning about the various programs offered through AmeriHealth and Keystone First. Each meeting, she's been able to take away important information that's been helpful to herself and others. She appreciates being able to give back by sharing ideas and participating in discussions. She says that it's important to be advocates for the services because sometimes the services might not be implemented as intended, or there's simply room for improvement and inclusion for the diverse needs of the community. She's really enjoyed meeting the leaders and making connections, and there have been opportunities for staff to go above and beyond to help her personally through the PAC meeting as well. So I can open it up to questions, but I also want to give Jay an opportunity to join us and offer his perspective on PAC as well.
Thanks, Nicole. So I'll be quick. Nicole and the team do a really good job. Those meetings, one, they're accessible, they're easy to communicate with. You can go there with just a general question looking for information, or you can go there with a very detailed question about your services or lack of services or issues that you're having, and the team is always very receptive. If they don't have an answer for you at that time, they get back to you within, sometimes the next day, the next morning. The team does a good job of providing the information, being very clear and being very open. But anybody that has any questions, I feel if you go there, you're going to get answered right away. If you're not attending the meetings and you have complaints, I think it's the best place to go because, as you see, I know we have a lot of these meetings and people say they have their questions not being answered. But if you are with AmeriHealth, if you go right to these meetings, those questions will be answered much more quickly than you may be surprised to find out. But just overall, they do a really good job. And as a consumer, I have no complaints, and I would advise anybody or give them my recommendation to choose them as their MCO. So thanks, Nicole.
Thanks, Jay.
Thanks, Nicole, and thanks, Jay, for sharing your story. I think, if you don't mind, if you could stay for questions until after the other two MCOs present to help us stay on track with time. Is Health and Wellness ready to proceed?
Hi, Kathy. This is Anna Keith representing PA Health and Wellness today. With me, I have Evelyn Parker, who is a PAC member and also a distinguished part of our board of directors at PA Health and Wellness. She's going to be presenting along with me. Joe Elliott is not available today. He woke up not feeling very well, so we're gonna pinch hit for him. Okay. In the interest of time, we will forego the technical pieces of our presentation. And Nicole did a nice job of sharing those pieces. Again, anyone can attend. Let's go to the next slide. The meetings are held. We would be remiss if we didn't thank our SIL partners that ensure that we have accessible facilities for individuals all across the 5 zones. And they are a strong partner with PA Health and Wellness in our efforts to do a good job at providing PAC meetings and ensuring voices are heard. And we have our meetings up there if anyone is interested in attending. We also post our minutes on the PA Health and Wellness website at www.pahealthwellness.com. And I think there's one more there. Yep. Evelyn, let's do something a little different. Let's talk about the new pieces. We are really investing energy in the 32 services being educated across our PAC. And I understand that there's a number of PAC members that want to actually be the presenters on that. Do you recall some of those conversations that have been had on the recent PAC meetings?
Yeah, basically that is what I, being a participant myself, appreciate the PAC meetings for, because it's a voice for us. I know a lot of us who are disabled or, you know, we're overlooked and overseen, so it just actually gives us a corner and a place to be heard and to be understood. So with your guys' PAC meetings, I really didn't even aware. I thought it was just PA Health and Wellness, but you have AmeriHealth and there's other people. So it's not even about just the voice, but getting that coverage, and that's what's needed. So I know on behalf of participants in our program and across others, I can easily say that we just want to thank you guys for even giving us a voice. Like, because before we didn't have no choice, we didn't have no say. And it's nice to be partnered up with the people who make the bigger decisions and things like that. And then you're also able to get in our side, so it has that more emotional feeling to it. So, yeah.
So I think, is there another slide there? Very good. We'll leave that at questions and maybe catch up on some time. Kathy, I'll turn it back to you if there's any questions, or we can delay them until after the presentation.
Thank you, Anna and Evelyn. I really appreciate both of you, and especially the participants who are joining us today, like Evelyn and Jay, to share your stories and for your advocacy. That's definitely helping others. I think we'll again hold questions and let UPMC provide their presentation. Thank you.
UPMC is making their way to the table, Kathy.
Good afternoon. I think our first presenter is joining us virtually, Benjamin Hampton.
Morning.
You're on mute.
Everybody hear me? Hi, thank you. Good morning. We can go to the next slide, please. My name is Ben Hampton. I'm the Community Engagement Coordinator for the Southwest and Northwest part of the state, and our Lehigh Capital Community Engagement Coordinator, Sia Pakiwa Gudekunst, is joining me in person today. We are excited to join you to discuss our Participant Advisory Committee. Next slide, please. So we want to briefly start by reviewing the PAC's purpose and goals. Next slide, please. And as the two MCOs previously stated, according to the CHC agreement, the PAC exists to advise on the experiences and needs of our participants. Next slide, please. And so this is a slide we actually show at the beginning of every PAC meeting, and this slide shows how we communicate the PAC purpose and goals to the committee. So we communicate to the PAC that the PAC purpose is to create a committee of engaged individuals willing to provide constructive feedback about UPMC CHC. Our goals are to respect participants' choices and improve their quality of life by using the feedback provided to improve the quality of services, develop relationships between participants, caregivers, and providers to create open communication and share information, and better understand participants' needs and ensure they have input about the services they receive. Next slide, please. Next, I'm going to talk a little bit about membership and recruitment. Next slide, please. Our statewide 2024 PAC membership includes 68 participants across our 5 PACs. We also have, yes.
I have a request from Chad to ask that you slow down.
Sure, absolutely. We also have 26 providers across our physical, behavioral, dental, and LTSS categories, 9 caregivers, and 4 stakeholders. The stakeholders are not a requirement, but we love to hear and include stakeholders from organizations that serve or impact our participants to add additional depth and feedback. Next slide, please. This table shows a further breakdown of our participant membership. The agreement requires that a certain percentage of our membership is composed of home and community-based participants and nursing facility participants. It does not specify membership requirements for our nursing facility ineligible participants, but we also want to make sure that we hear their voices and that we include them in the discussion. So we are working to include representation from those participants in each zone. Next slide, please. We use several strategies to invite participants to get involved with the Participant Advisory Committee. We work with our service coordination teams for participant referrals. Our community engagement team invites participants. We meet at community events to join the PAC. We do actually have a PAC recruitment flyer that we use in the community to generate interest in the committee. It has information about the PAC on the top piece, and there's actually a tear off that we can collect information for follow-up from the individual. We also conduct some database outreach calls and receive referrals from other CHC departments. Some participants even self-refer through the UPMC CHC website. So we do ask all prospective PAC members to complete a short application. It is available on our website or also via a paper copy. And of course, we're able to assist with filling that out if necessary. Next slide, please. And meeting logistics. Next slide, please. So our PAC meetings do occur quarterly as well within each zone. So we generally hold our meetings in March, June, September, and November. Members can attend in person or virtually via Teams or Zoom. In the Southwest, our meetings take place at UPMC Harbor Gardens on Pittsburgh's north side. In the Southeast, we hold our meetings at Penn Asian Senior Services or PASI in Philadelphia. In the Lehigh Cap, we host our PAC at the UPMC Camp Hill office in Camp Hill. In the Northwest, we use the Marquette Savings Bank Innovation Learning Center in Erie. And finally, in the Northeast, our meetings take place at Roads to Freedom Center for Independent Learning in Williamsport. Next slide, please. So our PAC really aims, our team really aims to make the PAC a great experience for all of our members. So we do this by making sure we send all meeting materials to our members beforehand by postal mail or email. We arrange for or reimburse participants for transportation to and from the meeting. We assure all in-person meeting locations are accessible. We also really try to provide time for PAC members to socialize and follow up with UPMC staff and each other at the beginning and end of our meetings. And this, of course, includes coffee, snacks, and lunch for those joining us in person. We really work to ensure each member joining online has as close to an in-person experience as possible. So we work very hard to help them feel like they are in the room with us. Throughout the meeting, we provide opportunities for members to provide feedback and ask questions. And each zone's PAC actually has a community engagement team member that's dedicated specifically to that committee. And that individual is the point of contact before and after each meeting. They conduct follow-ups on feedback, answer any UPMC, CHC, or PAC-related questions between meetings, and maintain relationships with our PAC members. We also conduct a feedback survey at the end of every PAC meeting to ask for suggestions to improve future meetings. Next slide, please. So I will now turn the mic over to Sia, who's joining us in the room, who will review a sample meeting agenda, how we handle feedback received during our meetings, and then you'll get to hear from a few of our PAC members who are joining you in person today. Thank you.
Thank you, Ben. Next slide. So this is a sample of our PAC meeting agenda. All of our PAC meetings are scheduled for 2 hours. For example, the LEI PAC meeting typically starts from 10:30 a.m. and it ends at 12:30. We start every meeting off with a welcome and introduction of our committee members and UPMC staff. Each committee member introduces themselves and they state their role on the PAC, participant, caregiver, provider, stakeholder, etc. After introductions, we'll review housekeeping items, which include the meeting goals and purpose of the PAC, the ground rules of the committee, one of which is Elmo.
Excuse me, could you slow it down, please?
Sure, I apologize. So we review housekeeping items, which include meeting goals and our purpose of the PAC, the ground rules of the committee, one of which is ELMO, which stands for Enough, Let's Move On. So committee members are encouraged to respectfully call out ELMO to keep the meeting moving forward. We do a review of restrooms and committee members joining the meeting in person, and we'll review participation functions on Teams, such as how to raise and lower your hand and type in the chat box. We share who the chat monitor is and the staff designated at each meeting that is serving as a technical assistant. We also go over the basic mute and unmute functions for those joining the meeting over the phone. All of our PAC meetings are intentionally developed for feedback and discussion, and each meeting highlights an LTSS service or quality topic, a health education focus, service coordination updates, which include eligibility reminders and behavioral health service coordination updates. The parking lot that you see on the agenda there is used to help keep the meetings on track in the event an important item is raised that may not be relevant to the discussion at the time, but needs further exploration. At the close of the meeting, our committee members joining us virtually are dismissed, and committee members joining us in person break for lunch. Next slide, please. So now we're going to just go over how we handle some of the issues that are raised during our PAC meeting. So almost all of the issue or concerns raised at the PACs are addressed and resolved within UPMC CHP. Where we do have an example of when an issue was raised at one of our PACs that required us to reach out to some of our partnerships. But first, this slide. So a member on the PAC goes, they raise a concern or an issue, which UPMC CHP documents the concern for feedback and follow-up. Typically, we handle this in-house due to the departments, one of the departments that provides one of the LTSS services. The issue or concern is directed to them. We then follow up with the participant, and most of the time, it usually has to do with the question they have with service coordination, so then that service coordinator also follows up with the participant. So that's just an example of how we close the loop with issues and concerns that are brought up during our PAC meetings. All right, next slide, please. So this is an example of how we really showcase our relationship with OLTL and community partners in addressing participant concerns and issues. At one of our PAC meetings, a participant raised a concern about the availability of COVID testing to be accessible for folks that are visually impaired. UPMC CHP documented the COVID test accessibility concern for follow-up, which we then reached out to OLTL for resources. And OLTL did share resources available for accessible COVID tests. We then were able to share those resources with the participants and folks on the PAC that were interested in this information as well. And we had an opportunity to share it with the Civil Center PA because they also had an interest in finding where they can access COVID tests through accessible programs. Next slide. So now we're going to have an opportunity to hear testimonials. We are lucky today to have two of our PAC members in the room with us. So go to the next slide, please. We have a few quotes on the slide, but I think I'm going to turn it over to both of our folks that are ready to go. We have Jen and Mark joining us, and they are current members of the Lehigh Capital PAC. And while Mark is getting ready,
So both of our members, they're just gonna share with us how long they've served on the PAC, the most meaningful experience on the PAC, and what they like best about being on the PAC.
Hello, everybody. Hello, everybody. My name is Mark Edwards. I'm from Lemoyne, and I've been on the PAC team for over a year. I really enjoy it. I got involved because, and I believe it's important for you to know, I got involved because there was a display from UPMC at Disability Pride. I went over and I met Lauren, and then we started talking, and she was talking to me about the PAC, and that's how I got involved. One of the things I like about the PAC meetings is you get to learn about information about topics that you had no idea you wanted to learn about. Like recently, we learned about dementia and this team that supports people with dementia and everything like that. And during my time, I've also learned about the phone benefit if you don't have a cell phone, and you can get the UPMC app on that cell phone and get all this information from UPMC. And personally, I've learned about how to set goals and that sort of thing, and how to prioritize things when you set goals with your little goal cards. I find it very beneficial because I get to meet people and interact with them and learn about their experiences too. And that's very important because it helps me grow as a person. And aside from that, it gives when I go to the PAC meetings in person, it gives my service cat, MC Cuddles, time away from his daddy.
Thank you, Mark.
Thank you very much.
Hi, I'm Jen. I've been a PAC member for a little over a year as well. A lot of Mark's comments are what I've experienced because we've kind of been along a similar timeline. He does talk about his cat a lot, and it is adorable. The most important part of being part of the PAC was, before I was part of the PAC, I would spend most of my time sitting in a wheelchair or sitting in my bed. It was a very lonely time, and the most visitation I had were from my home health aides. But being part of the PAC, it helped me realize that there's other people out there. Matter of fact, one of my favorite meetings, I met somebody who had the same surgery as me, go through some of the similar issues, and it kind of made me feel like I'm not alone. And that changed a lot of my emotional trouble and gave me confidence that I can get out of my wheelchair and do more things. And the PAC has taught me a lot of stuff, especially Thea. She usually has some kind of presentation. Thank you, and I'm a crier. She usually brings the emotions out in me as well with her presentation. And then I'm able to take what I've learned, because since I've been a part of the PAC, I have expanded my communications out in communities, and so now I'm more active talking to others and spreading the information that I've learned at the PAC meeting. Thank you.
Thank you, Jen.
If I would like to add one more very important thing. Back in the fall, the PAC had a community engagement session, and they had different vendors like the Center for Independent Living and Rapid Transit, and somebody from Department of Treasury to look up and see if you had any money, see if they had any money. But one of the most important things I got out of that meeting or event is I got my first flu shot. Up until that time, I never got a flu shot. And the reason I got the flu shot is it was convenient. I didn't have to go out of my way to get it. And being in town, transportation isn't the easiest thing to get when you need it. I got the flu shot at the UPMC event because it was convenient, and I think it's very important. And also got my blood pressure taken, and I wanted to even know that, and I wanted to share that with you of how important that is. Thank you very much.
This is Carrie Bach, and I just wanted to add that I too serve on the PAC committees in our area for each of the MCOs. A number of you know me. I work for Voices for Independence, so I'm attending as not only a participant utilizing services, because I do have a disability, I am there as a provider. And then also you heard mentioning of SILs, Pennsylvania, Voices for Independence as a SIL. And I can tell you that these meetings are very beneficial, and to be in a more intimate setting with the MCOs does provide that opportunity to ask some of those more detailed questions. And I also wanted to take a quick moment to especially thank our participants who have joined this conversation today, and those that made the trip to Harrisburg just to be a part of this presentation. So thank you. I applaud you, one, for being a part of it. Thank you for that. And also for making the trip. It's not easy.
This is Juliet. I want to echo Carrie's statements and sentiments. The work that every member of the PAC does is critically important for the almost 500,000 Pennsylvanians that use our services. And so when you participate and you share, you give your feedback, you engage in that open conversation and candid conversations, your impact is felt throughout the service system. And we at OLTL especially understand how important it is to ensure that your voices remain at the table always. And we thank you for the extra time, work, and effort that you have given us, your gifts, to help make it better. So thank you.
I think the next slide is just the question slide.
We're open for questions, Kathy and Carrie.
Yes, thank you. And again, I want to echo the sentiments as well and express my appreciation. We will open now for questions for each of the plans and the PAC participants. I had one question, and I'm wondering if CHC participants could attend a PAC meeting without being an official member, just to get a sense of what it's all about.
I can take that. Thank you. I can take that question. Nicole from AmeriHealth. Yes, participants are welcome to join a PAC meeting prior to committing to full membership and attending throughout the year. We encourage that even, and members of our outreach staff are happy to engage that participant even before the call, make sure that accessibility, any questions, any hesitancies to joining the call, because it can feel like a big barrier, a big hurdle to join the meetings. So happy to answer any of those questions ahead of time or have participants join without committing to full membership. That's absolutely an option. Thank you.
Evelyn Parker from PH Health and Wellness. We also allow open participation before you decide to make any decisions on joining the board. If you can and you want to come in person, you can always feel free to do so. But a lot of our meetings are held via Zoom. And if you just reach out to your service coordinator and your care team, they'll be able to get that information from you. Any further needed information, Greg Hirschberger, who is the leader of our PAC meetings, is also on this call. And I know he does a lot of the go-to to get that information set out in order to get a bigger participation within the PAC meeting group.
Yes, and this is still with UPMC. We absolutely open up we provide the opportunity for not just the participants, but sometimes our providers, because they're busy scheduled, to definitely join a PAC meeting as a guest. And in addition to doing that, some of the barriers that we encounter with some participants is that technology fear. So we actually go a step further and set up some time to do a Teams tutorial so people get comfortable with how to use the participation features before they join a meeting as a guest, to just try it out and then further explore their interest in joining the PAC.
This is Kathy. Thanks again for those responses and that work you do to encourage and support participants. Are there other questions from the room?
Yes, Matt Seeley has a question.
Well, first off, I think we need to incorporate Elmo. I don't know who was talking about that. I really like that Elmo thing. A lot of meetings, maybe even this meeting. But I didn't say that. My question is, I guess for all three of you, do you allow participants of other MCOs to come? And I'm just saying, I'm kind of wondering to myself, you know, if I'm just, you know, going to give you an example. Say I'm with UPMC, and I'm thinking, what is it like with one of the other ones? Rather than trial and error, how do you learn a little bit more about the other plans and the differences and whatnot? Would they be able to sit in on one of those calls?
Yes, I know as far as PA Health and Wellness, we have what is called open attendance. So that's just to kind of get the participant comfortable with who, I guess, you're asking, like, as with who better fits you. Is that what you mean?
If you're in that, yeah.
Yes, because the whole point of the PAC meetings is to get your bases covered and the things that you need. So with PH Health and Wellness anyway, if you're more comfortable, we want you to be comfortable. So it's really about you and what we can do for you, not only as a participant, but being able to take that for the thousands of those who can't be in those meetings. You're that voice that I was speaking about earlier. So that's what makes it important.
So this is Sarah with UPMC, and I may defer to Juliet here on this. So with the PAC, I believe it's a closed committee, because a lot of our participants that are there, when issues come up, we have the direct access to really speak to service coordination to really follow up on something. If someone is not a UPMC CHC participant, there's a barrier there to following up with what concern or issue might be raised. However, we do have all of our minutes posted on the website, and our community engagement team, we're out and about the community quite a bit. We're open to talk about our PACs to anyone who may have questions, who might be interested. As far as someone who may not be a UPMC participant, we definitely talk to them about that if they have any questions.
agree with UPMC on that. Our minutes would be a great way to learn about what's involved in the meetings. And also our community outreach team would be happy to have a conversation with anyone leading up to a meeting regarding how the PAC meetings proceed and what's involved. But those meetings would be limited to our MCOs participants.
Okay, everybody's always reading this, but just a separate question. One of you showed the members of your PAC, and it included people from nursing homes. I'm just curious, how do you, like, if you have it as you're being at a still, do you transport the person from a nursing home to there, or are they getting on Zoom? How is that happening? And are they hearing, like, what it's like living in the community?
Yeah, so this is Sia with UPMC. We actually provide, one of our slides showed that one of the things that we do, we provide transportation for our participants coming to, who choose to attend the meetings in person, and that includes to our participants in a nursing home residence. They actually can join the meetings in person. Same process we do for someone out in the community. We set up transportation, they join us, and for those who may not be able to join us in person, we go through the same tutorial to go through how to manage teams. We do that support, and we also always make sure they know who that point person is as the tech support the day of the meeting. But absolutely, transportation is arranged for folks who might be interested if they reside in a nursing facility.
Matt, that's the same for PA Health and Wellness.
Same for AmeriHealth, but I would also add that a participant representative is also could be available to join the meeting if it were a barrier for the participant to transport and weren't comfortable with Zoom, but a family member or representative were interested in being involved. They could also join the PAC meeting either virtually or in person.
Lloyd has a question.
Hi, Lloyd works here. I heard that UPMC provides financial remuneration for people who attend the meetings in person. Do the other MCOs do that as well? I just didn't hear that.
With AmeriHealth and Keystone, yes, we do.
Depending on what you're saying, financial, we can't pay them to attend, but we do reimburse, like if there's mileage and we provide a meal.
That was the question. Thank you.
This is Kathy. We have a question from Latoya Maddox. Did you want to unmute?
Yes, this Latoya. I was able to go on Keystone and PA Health and Wellness to find out who to connect with to learn more information about PEC, but not UPMC. So who's the contact person for UPMC to learn more about PEC?
So that, for the Lehigh Cap area, it'll be Steve Goodison, and my email is
I'm in the southeast area, sorry.
Southeast, that will be Erica Riley, who's in the room with us here today. So I'm gonna have Erica come on up, and she's gonna share her email so you can directly contact Erica. And I just wanna provide clarification on the reimbursement piece. Just like PA Health and Wellness, we only provide reimbursement for transportation and we provide a meal, but there is no payments to join the PAC or to attend.
This is Kathy. While that person's coming up, I would like to request in the follow-up questions if the contact information for the PACs could be put in the Q&A for easy access for people to reach out. Thank you.
Hi, this is Erica. I'm on the community engagement team for the Southeast. If you're interested in the PAC, you can reach out to me. My email address is reilleyee@upmc.edu.
Could you repeat that one more time for our captioner, a little bit slower?
Absolutely. reilleyee@upmc.edu.
I don't see any additional questions in the room.
Thank you, Juliet. This is Kathy. Are there any questions in the chat?
Hi, this is Shanrika Pine. We do have a hand raised. Brenda Dare, you are being unmuted.
Thank you. And this is a question for representatives from all three MCOs. At future PAC meetings, perhaps in the next quarter or maybe the one after that, would the three of you be interested in potentially having someone present to your PAC members about the importance of legislative advocacy and how to go about that? Jay mentioned earlier and Juliet mentioned earlier about the importance of talking to our legislators about getting rates raised. And that is part of the work that I'm doing with the Statewide Independent Living Council, is getting people engaged in that process. And I'm just here to say I'd be more than happy to present at any future PAC meeting on that subject.
This is Anna Keith with PA Health and Wellness. Greg Hirschberger's on the line, who facilitates our PAC meetings, and if he could provide his email in the chat, we would welcome more education along this line so that our participants and other advocates have some additional education.
Certainly. Thank you, Anna.
Nicole with AmeriHealth in Keystone. Absolutely. Would love to connect to discuss the opportunity to provide some more education to participants on future PAC meetings. So my email will be provided in the Q&A.
All right. Thank you.
Hello, this is David Gearin from UPMC Community Health Choices, and echo our interest in always looking for additional topics for education to our PAC committees. So you can reach out to our team, and we'll make sure that contact information is included so we can work to provide additional resources to our PAC committee members.
All right. Thank you very much.
And this is Carrie Block, and I just wanted to let you know that I'm also taking notes and took your suggestion down as a potential topic to bring before the committee to decide if that is something that we may want to present at the LTSS as far as, you know, legislative outreach and groups that you can join up with, or how to go about doing that. That may be something that also discuss and maybe bring it to this meeting. So thank you.
Okay.
And
You're welcome, Carrie.
Don't when that may happen, but we can certainly try. So thank you for that.
You're welcome.
I see that we have a question in the chat from Pam Wald. Pam, are you able to?
Yeah. Hi, I'm here.
Yeah,
I've been trying to figure out how to raise my hand. I guess a question for all of the MCOs. How do you respond and follow up when a member of the PAC raises an issue that affects not just them and perhaps not all the people, not just all the people in the room, but also a broader range of participants, or maybe even all participants? How do you respond to that and resolve the issue, and I guess communicate it to members?
Nicole with AmeriHealth in Keystone. We would, so if I understand the question, it's that the answer can't be directed just towards one PAC member because it's a question generally. We would answer that question providing in the feedback section of our minutes. And we would also follow up at the following meeting with a response to a question that was open-ended and needed some additional follow-up generally that wasn't specific to one person's services.
Maybe I should just clarify a little bit, not so much like a question, but if somebody raises something that is not working well for them, that is a problem in the way services are being provided that affects a broad range of members, how would you go about looking into that and responding to it and, you know, or would you, and making changes as a result?
So I can definitely follow up with additional information as well. But what I can say now is that part of what I spoke to earlier is that all feedback is moved through our QSC and QAPIC committees. So any general broader questions would be brought to the rest of the AmeriHealth Keystone departments that way, and then follow up from there.
If I may, just to ask a clarifying question, Pam, are you asking the MCOs to walk through the process of how a PAC recommendation might turn into a policy or a procedure within the MCO?
Yeah, I think that's a good way of putting it. Thank you.
So this is Sia with UPMC. Our internal process is whenever an issue comes up that's broader, that's not just specific to a particular participant, part of our internal feedback, our mechanisms that we have in place is that we feed information up the chain. So we do follow up with senior leadership, and in the event that something comes up, is that this pointing the finger more towards a systematic issue. Service coordination then does do they do trainings if it's pertaining to their department. There are trainings that happens, and depending on what it might be, it can result in like an actual change of how things are processed or the method of how something is being delivered. But our internal process is that we feed that information up the chain, and senior leadership then they handle that issue either internally or I'm pretty sure they reach out to LTL if it's something that's a grander system-wide issue. Thank you.
Evelyn Parker, PA Health and Wellness, we basically operate the same way. The great part about having this PAC meeting is not just having participants, but it's the different individuals from the different portions of services that are provided. So I know an example for PA Health and Wellness is transportation. So like when we have a discussion or one of our participants comes to our meeting and there may be something as far as transportation is concerned, being that that's out in the open, it's also placed in our minutes, and then our leaders can take that back to the actual company in itself and try to see if there is a solution that they can come up with, and then based on what they decide to do, then that information is kicked back out depending on what policy changes are made or what implementations may have been given. And then we are able to share and spread that information out since transportation is a situation for everybody.
Thank you.
We have a hand raised. Ben Hampton, you are being unmuted.
Hi, thank you. I just wanted to also highlight that we do use the feedback provided in our participant advisory committees to enhance our community outreach programs that our community engagement team leads. So for example, we've gathered feedback on health education topics, and we do take health education presentations to affordable housing and other community locations. And a lot of that feedback and some of those developments came from PAC feedback.
Thank you, Ben. At the moment, we do not have any additional questions in chat.
Thank you. Are there any other questions from the room or from members online?
There are no questions from the room.
Thank you, Juliet. So I guess we can move on now to our second final open forum for public comments. And again, I don't know if there's anyone in the room that wants to start.
I don't see anyone coming up to a microphone at this time.
Thanks again. Anything in the chat or any hands raised?
Hi, this is Shanrika Pine. No, we do not have anything in chat at the moment.
Okay, thank you. We'll give it another minute or two. I did want to point out that our next meeting is May 8th, which is listed on today's agenda. The date on the website is not correct. The office, TL needed to make a change so we could have, the room was not available on May 1st. So we appreciate OLTL's work to secure the room, and so we can have a hybrid meeting in May. But I did want to point that out, that the date currently on the website is not correct. We will be meeting on Wednesday, May 8th. So before we adjourn, I just want to circle back to make sure there's no other anyone that wants to speak, either in the room or online, in the chat or raised hands.
Hi, this is Shanrika Pine. I actually do have a question that just came through in chat.
Go ahead, thank you.
This question is from Janice Meinert for PHW. We are getting an influx of calls regarding pass reductions. Notices routinely says something very similar to based on the documentation provided from your PCSP and inter-array assessment, it was determined that the level of assistance needed can be met with X pass hours. Nothing in the decision explains the reason for the reduction. Is PHW working on improving the notices?
Yes, thanks for that question. This is Anna Keith with PA Health and Wellness. Yes, we are working on improving the way that letter's written, and we agree it needs to have more specificity so that the individual receiving it understands what's being recommended or the reason why, more specifically, that the services were reduced.
So just to add to public comment, I just want to acknowledge we received some written comment from Ms. Angela Beisecker with regards to the Attorney General's assistance. Those public comments will be posted as our other follow-up responses.
Is there any? Go ahead. I'm
sorry. I also have a hand raised by Brenda Dare. Brenda, you are being unmuted. Brenda, you can unmute yourself.
Sorry about that. Juliet, this comment is for you. You mentioned that there is a home care hearing coming up in the legislature on May 8th. Are you able to provide us with any information on where to find out more about that hearing?
It should be listed on PA.gov website for the House of Representatives.
Okay.
For schedule, but let me see if I can pull up additional information really quickly. Huh? That's right, April 8th.
I'm sorry, did I say May?
April 8th.
I meant April. Yeah.
The same day as the solar eclipse.
Yeah.
Here. It's being held by Representative Kinsey, Representative Kim, Representative Heffley, and Representative Menser of the House Aging and Older Adult Services Committee. So it would be on their committee schedule. I believe it.
Alrighty.
That and also held in person. I will be testifying in addition to representatives from managed care organizations, and other guests as called by the committee chairs.
Thank you very much.
Yep. And the topic in particular is home care, with, I believe, a special focus on value-based payments in other funding.
Thank you. This is Kathy. Are there any other, anyone else that wants to speak, to comment, or have a question?
We have no additional comments in chat.
Thank you. And I'm assuming none from the room, or is someone going to a mic?
There are no questions in the room, though Fatty keeps staying very close to a microphone, so I'm never quite sure if one's going to come up. Let the record show he has rolled back from the tables, and so I can confirm there are no questions in the room.
Okay, we always like last words from Fadi. All right then. Well, I'm surprised we have this much time left in our meeting, but I do want to express appreciation for everyone today for your participation and feedback, especially our special guests of the PAC participants. We can't thank you enough for sharing your stories and your advocacy, and it's important work, and I'm hoping you encourage others to join you know, those important committees and that important work. And unless there's anything else that's come up, we can take a motion to adjourn.
So moved.
Thank you, Lloyd. All right, well, thank you.
You're welcome.
I hope everyone has a great day, and we'll see everyone again on May 8th. And if you have any feedback about these meetings, please don't hesitate to reach out to Carrie or me. Thanks again.
You're welcome. Have a wonderful day.
You too.
Thank you, everybody. This is Carrie. We appreciate all of your feedback.
Thank you. You're welcome, Carrie.
Thank you, Kathy.
Thanks, Linda. Stay well.
Yeah, I'll probably be on the website next month as well.
Okay. Let me know if you need anything, or if there's anything special you want on the agenda.
Yeah, I'll think about it, and I know that they're going to the Google page, or, you know, whatever
Right.
they put up.
I'll send a reminder out to members.
Okay. Thank you.
Thank you.
Thanks for doing that, Kathy.
Oh, sure. Now I'll get working on that later today.
Absolutely.